Hello, this is Dr. Joanne Manson, professor of medicine at Harvard Medical School and Brigham and Women's Hospital. I'd like to talk with you about a recent randomized trial to reduce sitting time and lower blood pressure in older adults, the HEART study, published in JAMA Network Open. Now, we know that reducing cardiometabolic risk in older adults is very important, and there's perhaps no more promising target than sitting time, because we're a sedentary society, and among older adults, on average, more than 70% of time is spent sitting during waking hours. Observational studies suggest that longer sitting time is associated with increased risk of cardiovascular disease, type 2 diabetes, and all-cause mortality. But those studies can't prove a cause and effect relationship because there are many medical chronic conditions that are associated with longer, more sitting time. So a randomized trial is important, and the researchers undertook a pragmatic clinical trial. These are researchers at Kaiser Permanente in Washington State, and they did a trial that was primarily conducted during the pandemic and included 283 adults with a mean age of 68, all had a BMI above 30, and 52% had diagnosed hypertension, most of whom were treated with antihypertensive medications. And this trial had an intervention group that received coaching, health coaching, at least 10 contacts over 6 months for the purpose of reducing sitting time, breaking up bouts of sitting, increasing standing time, and also the intervention group received a standing desk and a fitness tracker to prompt breaking up sitting time. And the control group was an attention control group that also received 10 contacts by phone, but this was not focused at all on physical activity or sitting time, but rather on general healthy living goals. And in this trial, sitting time, physical activity were monitored by accelerometer and at 3 and 6 months, and also the blood pressure was measured by Omron device. And the randomized trial did show a reduction in sitting time at 3 and 6 months, a 31-minute reduction in sitting time at both time points with p less than 0.01 at both times. And for systolic blood pressure, there was a significant 3.5 millimeter mercury reduction in the SBP at 6 months. That was seen in both men and women. Women also had a significant reduction in diastolic blood pressure levels. So the randomized trial did show reduction in sitting time, reduction in SBP. Now, you may be thinking that's a small, modest reduction in SBP, but the co-authors provide a context that increasing aerobic exercise, which may be more challenging for older adults with chronic medical conditions, tends to lead to a 4 millimeter reduction in SBP, not much different. In the DASH diet, a 5 millimeter reduction, even antihypertensive medications, in many trials, just 6 to 7 millimeter mercury reduction. So we do need larger trials to try to replicate. We also need maybe more intensive interventions that could reduce sitting time by 45, 60 minutes a day, which may be feasible based on other evidence. But even based on the current evidence, recommending to our patients to reduce sitting time, to break up sitting bouts, should be considered that this may lower blood pressure and may end up improving our patients' health. Thank you so much for your attention. This is Joanne Manson.